My name is Chandler Clark. I'm a master's student here at Northwestern University studying biomedical engineering, and I design physical therapy equipment. So before I get into my device and what I've been building, I want to tell you a little bit about my background and why I love physical therapy and the idea of returning patients to their best possible self. So I played soccer in college, was at the top of my life playing, loved it so much, and made one wrong turn and tore every ligament in my knee. So I was in physical therapy, intensive physical therapy for a year, and then followed it up with 2 more years of more maintaining physical therapy. So I had an amazing physical therapist, and I would follow her around all day like the little sibling that everyone hated and just ask why. Why are you doing this? Why is this going on? Why can this not be improved? And she finally looked at me one day and kind of yelled at me and was like, stop asking, just do it, just make it happen, improve physical therapy. So that's kind of led me to where I am today. And this device I want to talk to you guys about is my first stab at improving physical therapy. So manual muscle testing is one of the most performed tests in the physical therapy environment. And just as the name suggests, it involves a clinician pushing on a patient to manually test the patient's strength in each muscle group. Now, this is well practiced, well versed. The issue with this current testing, though, is actually the scale. So the scale ranges from 0 to 5, 0 meaning the muscle does not contract at all, which is really easy to see. A 1 means the muscle can contract, which again is easy to see. A 2 means that the patient cannot resist gravity, so as if a patient has their arm on a table, they can move horizontally, but they can't pull up on their arm at all. Again, this is pretty easy to see. And the third, a grade 3 means that the patient can resist gravity. Now, all these are what we call objective values, and these objective values are facts. It's either a yes or a no, and that's it. Where the scale gets a little iffy and turns problematic is in the 4 and the 5. Now, many manual testing scales break this down to a 4 minus, a 4, a 4 plus, a 5 minus, and a 5. But these 5 values still cannot completely tell a patient's strength. As it says in the scale, there's mild pressure and there's full pressure. But what does this actually mean? My full pressure pushing on a patient that could give them a 5 scale is completely different than someone like Chris's, who could probably push much harder on a patient, and that would be a 4 scale for what that patient can resist. So this is a big issue in the world of physical therapy because these subjective values determine a patient's protocol and how they can return to their best possible self. So I came to my PI, and our research involves designing something that fixes this problem. So take these subjective values and turn them into completely objective values. The issue with this is that these devices already actually exist in the world. So these devices don't actually only exist, they are not being utilized. And after some more research, after talking to several more physical therapists, we found out that the reasons they're not being utilized are because of the size of the device, which, as you can see, the one in the middle takes up a lot of space in the clinical environment. The ones on the outside, though, are really awkward for physical therapists and clinicians to use, and they can't appropriately perform their manual muscle testing task. The second big issue is ease of use. So because these are large, physical therapists don't want to carry them around with them everywhere or go back and get them. If the device isn't sitting right next to them, they're not going to use it. It's just practically how they work. They're in routines. They want to get everything done. They want to move on to the next patient when they can. The third issue is cost. So the one in the middle costs around $20,000. Even the outside ones are about $2,000 a piece. And this is a big commitment for even small practices to commit to a device like this that they can only have 1 device per 5 physical therapists. Again, this is not practical in the environment they work because they can't all share one. It's just not going to happen. It's just going to be left in a corner somewhere, or a single physical therapist is going to use it and no one else will. So the one problem we had before, the big overlaying one of the subjective values turning to objective values, has now turned into 4 problems of solving the problem of size, ease of use, and the cost. So this is my design right now and what my lab has come up with. This is actually a prototype of my device. This is a shell of it. As you can see, it is much smaller, fits in your hand very easily, so a patient can be pushed on for the test or they can be pulled on. It can easily fit in your pocket, very small, so this already solves the first issue that we were looking at, the size. The second issue that it solves is the ease of use. So as you can see on here, there is an attachment on the top. We actually have different attachments that we are designing right now so that it is more comfortable for patients to have on their body and to be used in different parts of the body, depending on where you're using it. The third issue, and obviously the big issue, is taking the subjective values into objective values. Now in here, it's a very simple design. It's a load cell that takes in the force and just outputs a pound or a kilogram newton, something along those matters, instead of some subjective value. So instead of a 4, you get an 18 pounds, something along that measure. So here's kind of a scale of what it looks like currently in the standard manual muscle testing scale. As you can see, it looks like a 4. It jumps a little, slides across, jumps a little, slides across. But what does this actually mean in the physical therapy environment? It could mean a patient is making steady progress. It could mean they have made progress, but they kind of planed out. All of that you can't tell in this. And again, this is really important for patient protocol, but it's also really important for insurance justification. So if anyone knows about health insurance, they only give you a certain amount of visits per year. But if you can maintain that you're showing progress, they will give you more visits. The issue is you have to show you're making progress, and this scale does not show that. For one, it's already maxed out at 5, so it shows that a patient cannot make any more progress at this point. The other reason is it's all based on opinion. So no insurance company is going to look and say, because of your opinion, we're going to give you more visits. They need some actual factual data. My device will turn it into something that looks more like this, one of these 3 graphs. So all of these directly correspond to the previous graph. They can all be seen in that. Obviously, the black one shows steady progress. So a physical therapist, clinician can look at that and say, hey, we are making progress. Let's continue doing what we're doing because it's working, so a patient can continue to recover. Same thing with insurance justification. They can see that a patient is making progress, and they can continue giving visits over that time. The blue one on the top there shows that a patient made very good immediate progress, but is kind of planed out. Once a physical therapist sees this, they can say, hey, we need to change this protocol to make physical therapy harder, to change it a little bit so that they can continue to improve. The one on the bottom, the red one, shows that a patient did not make much progress over the first 2 months, the first 8 weeks. And this could either be because the protocol was too easy or was too hard, that the patient could not complete it. But at some point, that cannot happen, that a patient has wasted 8 weeks of physical therapy before they actually start making progress. So I think it's clear to see why this device is needed in the physical therapy world. The idea that having any clinician work with any patient at any time is something that needs to be brought in the world as soon as possible. And I strongly believe this device is the first step in doing so. Thank you.